I just want
Okay.
yeah, I just want to make sure I can share screen. Do
Oh,
you mind turning my,
I need
if
to make
that's
you into
possible?
a post. Post, there you go.
Oh, fabulous. Thank you. Can everyone see my screen?
Yep.
All
Okay,
good.
awesome. Thank you. Okay, so welcome everyone, and thank you for joining us for this session on building inclusive care for 2S LGBTQ plus residents, our live forum, one of two. Again, my name is Gabriel Forrester. My pronouns are she, her, and I'm a primary researcher with Rainbow Faith and Freedom. So a little bit about RFF before we dive in. Rainbow Faith and Freedom is a Canadian-based organization working to confront and end religious-based homophobia and discrimination against 2S LGBTQ plus people. We believe that faith and inclusion are not opposite. They can coexist, and they do coexist through compassion and understanding and dialogue. Our work combines research, education, and advocacy to help communities, faith groups, and institutions create spaces where everyone can live and worship with dignity and safety. So this conversation that we're going to have today is rooted in real stories, data, and practical change. It's also going to be a bit of a conversation. So it's less me just speaking to you and us talking to each other. So if anyone wants to come off mute, if that's a possibility, or write in the chat, please do. I can't really see the chat as I'm presenting. So Ian or Kayla, if you want to jump in and let me know if someone has their hand raised or if there's a comment, let me know. Thank you. Okay. So just briefly, our agenda today, some things we'll be covering. We're going to start with a bit about who we are here at Rainbow Faith and Freedom. I know I gave a brief intro, but we can get more into the weeds in a little bit, followed by an overview of this research project. And then we're going to highlight some insights from PSWs that we've spoken to already, the people truly on the front lines of care, similar to you guys. After that, we're going to share a call to action and open the floor for discussion and questions. Okay, so about RFF and this project. So Rainbow Faith and Freedom is a global movement to confront religious-based 2F LGBTQ plus discrimination and to improve the human and equality rights of 2S LGBTQ plus people everywhere. Our goal is to improve equality and human rights, not by pitting faith against queerness, but by showing that both can coexist with compassion and dignity. We work with communities, faith groups, and care providers to build understanding and tools for inclusion. So our mission and values. Our work is guided by 5 core values. They include learning, respect, teamwork, results, and compassion. These values aren't just words, they frame how we approach every partnership, whether we're working with hospitals, long-term care homes, faith organizations, schools, provinces, other organizations. We strive to listen deeply, collaborate meaningfully, and create measurable change. So building inclusive care, we're going to dive a little bit into the project. So this research grew out of a simple but really urgent question. What is it like to age and receive care as a queer person, especially in spaces influenced by faith and religion? So we know that many long-term care and hospice settings are built on faith-based traditions. And while they can offer community and comfort, they can also be spaces where queer and trans seniors feel unsafe or unincluded or unseen. So our study seeks to explore ways that we can close that gap and address that need to create care that is inclusive, affirming, and spiritually safe. Okay, so the purpose of this research, is threefold. We want to raise awareness about religious-based homophobia and transphobia in senior care, so looking at that intersection. We want to develop resources like toolkits and training that help PSWs, nurses, admin, and other folks who work in this field feel really confident in supporting queer and trans residents. And then finally, the final pillar is to provide actionable guidance for institutions. So inclusion isn't just a buzzword that's kind of thrown around, but it's tangible and measurable and is rooted in policies, training, and the culture. Okay. So this research matters. That can be self-evident, but I'm going to say it anyways. This research matters for a plethora of reasons. We've heard time and time again that queer seniors are more likely to face isolation and discrimination. Many hide who they are in these spaces, even after decades of living openly, sometimes because they fear judgment, but it can be for a plethora of reasons. Religious bias can unintentionally shape how care is delivered, but PSWs are often the change makers. When you lead with empathy and respect, the ripple effects reach entire teams and change the lives of seniors. Inclusion benefits everyone, residents, family, and staff altogether, and ultimately improves the quality of care that's being delivered. So this particular project has a three-phase approach. The first phase is at the institutional level, where we spoke with admin and leadership at long-term care homes and hospices about inclusion policies and procedures. Then the second phase, we surveyed residents themselves to understand their lived experiences, especially differences between queer and heterosexual residents, to kind of measure the difference and do a comparative analysis. And finally, we're in the third phase. So this is kind of our feet on the ground phase. We're focusing on you, PSWs, through interviews and surveys, to those who provide direct hands-on care daily and who are providing the care to folks who live in long-term care homes. So together, these perspectives will give us a complete picture and really color the insights and give us a lot of really rich depth and insight. From institutional policy to the personal of everyday reality of care, we're really trying to understand the full scope of what it's like. So as I mentioned earlier, we've done phase 1 and 2, and we're currently in phase 3. So I'm going to give you just share some of the insights that we've gathered from the first 2 phases, and then we can kind of dive into a bit of a conversation. So we have resident insights. So I'll let you guys spend some time reading this or meditating on it. But in terms of discrimination, 1 in 4 residents, or 24% of residents, have seen or experienced discrimination based on sexual identity. Half of queer residents feel the religious services in their long-term care homes are not welcoming. 1 in 3 queer residents do not feel comfortable talking about their identity with other residents and staff. And about half of long-term care residents believe that clear policies on discrimination would make their homes feel more welcoming. So these are insights that residents told us. And these slides or these stats really highlight some key findings from surveys that we did with queer and heterosexual residents. Sorry. We also see here, we did a general question asking residents if they feel safe and respected in their long-term care homes. So here's what we learned. When we compare feelings of safety and respect between 2SLGBTQ+ and heterosexual residents, the gap was really visible. This reinforces the importance of ongoing education and awareness and proactive inclusion, not just reactive measures when something goes wrong. So you can see the queer residents' responses on the left-hand side and the heterosexual residents' response on the right-hand side regarding feelings and sentiments of safety. Okay, so before we move on ahead, let's chat. I'd love to pause here and hear from you. You can write in the chat or raise your hand if that's an option. I'd love to pause here and just hear from some of you. Do these findings resonate with your experiences? Are there any surprises here or anything that caught you off guard? I'm just really curious to hear if this resonates.
We'll give a minute for everyone to jump to get into the question. If you don't mind, I think I can start. I'll start the conversation if you don't mind.
Yeah, absolutely. Please.
So, I mean, I was looking at this. He's actually quite surprising on some levels, but on the other hand, I'm not surprised. I think one question I have, if you can go back to the other survey, long-term care results, did your survey capture what age group generally you were looking at? Or was it people that would be considered geriatric, or was it, because LTC right now is sort of in a transition where there's a lot of different ages coming into there. So I was wondering if there's, because this looks pretty high, 25. And I mean, 21% compared to 12 is a big difference when they're looking at comfort levels, especially in the
Mm.
following number. I know, I'm just wondering do you think it's possibly that the older generation's views are just kind of continuing to permeate into long-term care? Because
Yeah, that's
is that
mhm,
like a little bit? I mean, notwithstanding the religious element, that's a separate issue. I'm just wondering offhand.
definitely. Yeah, no, I think religion is a huge thing. And you'll notice the asterisk in the bottom left corner, which says of those who currently attend places of worship. So I definitely think that age plays a huge role. I think that the way care is delivered plays a very significant role as well. And then the overall culture of long-term care homes. There's a great variation between rural and urban spaces, between ages, and then also the ideologies of people who are delivering care and the ideologies of other residents in those spaces. In terms of do residents feel comfortable coming out or expressing their gender identity or sexuality if other residents in the home might really hold strong to certain beliefs. I
Yeah,
see my colleague Kayla has her hand up, and then
yeah.
I also noticed that there was another hand up in the
Uh,
attendance, Pauline.
we
So
have
I'll hand the floor over to Kayla, and then Pauline, I'd love to hear what you have to say.
Great. I was just going to add on to give some context on the survey. It was 100 Ontario residents currently living in long-term care homes, and all of them were over 65 years old. But there was a range in ages going up, I think, into the high 80s there. And Ian, is the chat enabled? I'm wondering if panelists or other folks are able to access the chat feature. Oh, it looks like
Oh, you're
somebody
muted.
did.
Oh, you should. I had myself on mute and talking, like this is only my 20,000th time using thing here. Now, we had an attendant with their hands up. Was that Pauline? Did Pauline get?
Yes.
Okay.
Um,
All
it
right.
was Pauline, but we'd love to hear from her. I don't know if she or if they have the
Let's
ability to themselves.
allow her to talk. Pauline, are you
Oh,
there?
okay.
I'm trying to unmute. Can you hear me?
So, what we can hear, you're working together this evening. Thank you for your patience.
Yeah, I just wanted to mention the chat seems to be disabled.
Let me see if I can figure that out. Yeah, I don't see the chat in here. Give me a second. I don't want to. In the interim, can you feel free to ask your question while I see if I can remedy that?
Actually, that's just why I raised my hand, was to mention
Okay.
that the chat is disabled.
Well, thank
Okay,
you.
well,
I saw.
anything.
I appreciate that, Pauline. Thanks for bringing that to our
It's
attention. And I did see another hand go up. Let me just see who that was there. Yeah, it looks like the chat might be working now.
It could be that I had it set for just me and the panelists. I apologize on that. Feel free to jump in there. So, thank you for bringing that to our attention, Pauline. So yes, if there is chats, let us know. Feel free to use the Q&A as well. I'm finding these numbers remarkably high, actually. I mean, a half of the 52%. Now, your survey, did it look at homes that were specifically religious based, like those that were founded, for example, by churches, mosques, that kind of thing?
There was a range in the survey data, but some of these stats, so this is like 52% of the residents that are part of the queer community.
I
So,
understand. Yeah.
yes. And from some of the interviews Gabriel and I have done so far, kind of immersing ourselves in the spaces and our work with RFF more generally, unfortunately, these numbers aren't too surprising for us. They tend to be in line with the experiences of queer folks in places of worship and trying to find that footing in terms of inclusivity. So for us, unfortunately, the sad reality is these seem pretty much on par with what we've seen, but yes, quite shocking for sure that over half are feeling not as welcome in their space.
Still saying chat is disabled. Okay. Let me see if I can get the chat working. I'm just having a bad night. I don't know
No worries. I
Oh,
also
that's
see
okay.
that there's a Q&A feature that it looks like some folks were able to write some
Yeah.
messages in. So maybe we can use that in the interim.
Yeah, absolutely.
Yeah,
Let's
please.
see.
Yes. So like when you're talking, so do you have any anecdotal evidence? Because we get responses, but they're more like we get some responses from PSW saying, they encounter having LGBT people in their community and in their caregiving, but it doesn't seem to be a big issue
Mhm.
for the PSWs generally. I find generally the population very supportive of this. So
Mhm.
these are I guess there's a lot of resident animosity, I guess, in a lot of cases. Again, back to the previous generation, being part of this community for the last, it's gone through a lot of transitions from the 1970s till today. So a lot of those
For
people are
sure.
now entering into the long-term care facility, and they may not be themselves personally ready to share their residences with other people, despite the
100%. Ian, you nailed it on the head. So anecdotally, we've spoken to a few PSWs so far, and they've said things like, oh, their residents will say, introduce their partner as this is my roommate. And they're using very coded language to, avoid being shunned or oppressed because they grew up in a generation that it was not okay to come out and say, this is my partner. So the PSWs are equipped to kind of decipher and decode these messages. And all of them that we've spoken to are, providing the best care that they can and trying to make this resident feel included. And to your earlier point, a lot of the discrimination is coming from their peers, who seem to be able to sniff out homosexuality very well. It's like they can see it and smell it from a mile away. And they're experiencing that, but not from the PSW so much. It's coming from their peers.
Wow. Okay.
Yeah.
Okay.
Thanks, Kayla. I also do I do want to note there were some instances where like some long-term care homes will receive volunteers. And there was a couple instances where we learned that some of the volunteers were uncomfortable with the use of things like pronouns or other things. And so they made a bit of a kerfuffle and they chose to leave. And that stirred up some contentiousness, and that was a bit contentious in that long-term care home. So we see stuff like that. We also see a big, and someone mentioned this, an anonymous attendee, so thank you for contributing, mentioned this in the chat as well. This is something we've seen frequently, is that sexuality and gender are just not topics of conversation at all, which therefore leads to uncomfortability. So this attendee mentioned that as a PSW, one time in LTC, no one ever shared if they were part of the queer community, but it was also not in personal file or care plan. And so we've spoken with long-term care homes and senior management where there's debate about asking residents their pronouns. But this is a really big point of contention because for some people, pronouns are really important, especially if you're a trans resident and you need to be placed in the right wing of the facility, for example, if it's a gendered facility, and so, or long-term care home. So these are kind of ongoing discussions, and we're definitely seeing that there are various reasons why people might not necessarily feel safe.
I can see that, yeah. Because it's kind of up to the individual, and kind of to the point where also want to add that the PSW schools could do much better on discussing this in pronoun use. Absolutely. I don't think this is covered a lot in Mosby's, but I think this is something that we do need to investigate a little bit more, because this is an issue for a number of residents, as you can see. And pronoun use, not everyone understands its importance, but for certain people and for certain groups, it's extremely important how they identify and it identifies how they themselves relate to society and how they want society to relate to them. So I think that's a very good point. Fascinating. Comfortable talking about their identity as residents and stuff. I think that's normal for that generation. But I think that's part and parcel, but it's still, I see it. Okay, so what was the next slide? Sorry, I don't mean to jump ahead.
Yes, no. Thank you. Thank you for everyone who shared. That was really great. And then these are the survey findings about feeling safe and respected in long-term care homes. On the left, you'll see 2SLGBTQ+ residents, and on the right, you'll see heterosexual residents respondents.
Right. You mentioned that there was a discrepancy between rural, we'll say for the benefit of this discussion, rural versus urban homes. Is there, for example, more tolerance in rural areas and less in urban, or vice versa? Did you discover any sort of data that relates to that?
Yeah, I think in general, urban spaces are a little bit more inclusive. Obviously, if it's religious versus secular, if it's municipally run, if it's run by the municipality versus like a private space, those all play roles. But we spoke to a publicly run long-term care home, for example, really close to the Village in Toronto. And they take people to watch queer films and they participate in Pride. And so there's a bit of a distinction. And then the instance where one of the employees at a long-term care home started using pronouns because they were non-binary. They started using pronouns in their email sign-offs. They had a bit of a kerfuffle, and quite a few of the volunteers decided to step down from their roles. That was more rural. So we see that we've seen a trend, and that's just an anecdotal example, but we've seen a trend in that.
No, I was just curious on just for its own reason, just seeing if there was, because it's some of the things we encounter as well. It depends on where you live. You can
Mhm.
encounter these things. So thank you so much. I appreciate that.
Yeah, thank
Yeah,
you.
and then schools should do more about this. For the benefit of this discussion, and I know this might seem like second nature to you both, and I apologize, but for everyone on this,
No, not at all.
can we get the full, what is 2SLGBTQ plus?
Yeah, absolutely.
I
Thanks
realize that a
for,
lot of people are like, we live in acronym land in healthcare, so I
yeah,
think it's beneficial that we define exactly what the entire group is. So
definitely,
thanks.
definitely.
Thank you.
Thanks for raising that. So 2SLGBTQ plus stands for Two Spirit, which is an Indigenous identity, Two Spirit, lesbian, gay, bisexual, transgender, and questioning or queer. And then the plus is for any other acronym that may not be included. So, for example, pansexuality is not in there. And so the plus is kind of just the umbrella. But again, that is Two Spirit, lesbian, gay, bisexual, trans, queer, questioning, and anything else.
Okay. Thank you.
Yeah.
I asked because when I was in college, it was just LGBT. The Q came in after, and then I lost touch, and it sounded like there were other letters. So now I had to ask, and I realized other people of my age group might just want to make sure we're on top of all that. So thank you so much.
Yeah, no, absolutely, absolutely. Yeah, thanks for surfacing that question.
No problem. Okay, so what do we got next? Please continue with your presentation.
Yeah. Okay. So the second prong was some institutional insights. So these come from high level folks who work at long-term care homes. So this is kind of what we heard. It was that the good news is that there's a strong commitment to inclusion at the institutional level across many organizations. Most of these spaces, especially if they're public and publicly run, have zero tolerance discrimination policies and aim to be proactive rather than reactive. But then when we kind of got into it, what we heard from PSWs and other folks who actually work on the ground is that good intentions don't always reach the front line.
Yes,
So some
Sorry.
so some PSW insights from those we've spoken to so far. PSWs obviously play a vital role in shaping residents' daily experiences. So we wanted to hear directly from them. And their insights were some really powerful, they provided some really, really powerful insight and clarity into the entire study. So what we heard was that there's limited training on care for 2S LGBTQ plus residents. And if training does exist, it's very prescriptive and not super engaging. Many residents hide or code their identities, saying things like, oh, this is my roommate. Workers have a strong desire to be supportive, but little time or capacity to do so. And then there's uncertainty about how to be respectful to trans residents, especially in certain nuanced cases where maybe for medical reasons, they have to stop taking their medication, like their transitioning medication, so HRT or any other sort of medication like that. And so they don't present how they identify. That can be really conflicting for folks. And then there's uncertainty about how to respectfully support them. And funding constraints often limit what's possible beyond basic care. So obviously, money plays a big role in people's in training and that kind of thing. So these insights highlight how deeply inclusion depends on training, time, and leadership support. And so that's something that we really found in this work. Sorry, there's something in the chat. Oh, thank you, Kayla.
Thank you so much. Oh, we have actually something from a question.
Oh, yes.
I'll read it if you like. And aren't LGBTQ plus residents allowed to share rooms in LTCFs like other heterosexual couples sometimes do? I'm asking because I haven't seen this. So yeah, I mean that does happen in long-term care. Two couples can share. LGBT couples can share together. I've heard of that. Have you discovered it as well, Gabrielle? Or
I do believe that, yeah, I do believe that's definitely the case. It's also a level of comfortability. And if they want to disclose that they're a couple, sometimes they'll say we're roommates. And that might just be even because of like a generational thing. They've only ever identified as roommates. And that could also be due to societal constraints and just a lack of open discussion around sexuality in long-term care homes. If you don't talk about it, you don't know if it's safe or not. So you just would rather be quiet than, open yourself up to hate and discrimination.
Yeah, because in some of those cases, those, like, for example, the roommates you see from that older generation,
Mhm,
they presented to their family as roommates, but I think
mhm.
everyone in the family knew, but it was generally just discussed, and it was just, that's the roommate, that's all it is, and
Yeah.
it could be that's carrying on to protect the continuity of family relations, we'll say, well, for the benefit of this discussion. That's awesome. Okay, please continue. What was your experience?
Yeah. Yeah, thank you. So I'm gonna open up the floor again. Let's chat. I'm curious to hear about your experiences as PSWs. What has your experience been like working with queer and trans folks, if at all? And then I want to know what would be most helpful for you in providing inclusive care. So some examples of that might be training, language guidance, policy clarity, something else. I'm really curious to hear about your experiences.
Yes, can everyone come off mute? I will allow everyone to speak. Let's just bring everyone on, eh? And
Yeah, yeah.
we'll see if this works. I've never done this before on a webinar, but
Mhm.
everyone is now a part of this webinar. Feel free to unmute at your leisure and raise your hand and we can dive in. I'm going to jump to the second one. I'm not a PSW personally. I have been in cases where we've worked with, in the past, I was a human resource for developmental service workers, and a lot of the people
Mhm.
we supported were LGBTQ. And from the perspective we had, I got to say that the home care nonprofit that was we went to a lot of great efforts to deliver LGBTQ communities, and yet the home facilities itself were raised on a very Christian traditionalist model. But within that model, they supported the identity of those individual people fully. So it was
Mm.
a rarity. I didn't see that too often, but we saw very evangelical Christians
Yeah.
actively going to gay pride parades with their residents, but
Wow.
themselves didn't necessarily agree with it. But they're like, they love it. We're going there for them. So
Wow.
it's I would love to connect more with that theory, but they
Mhm.
did excellent work. Anyway, discussion. That was the experience I remember. So there was some of that, but we've seen a lot of negative as well.
Yes.
I'm going to jump down to the second one. What would be the most helpful in for you providing more inclusive care? I think that's been discussed, and I think, and anyone on the chat, anyone on the group, please tell me if I'm wrong. But I think the issue is, um, like you said earlier, these visions at the top of we have zero tolerance. We're going to create this vision of peace and harmony within our society, within our facilities, and then comes down to the PSW, gets distilled through directors and administrators and managers and directors of care, then the supervisory nurse. By the time it gets to the supervisory nurse, it's only just a theory. It's just like they're just saying, if you can, don't forget, because these guys are off
Mm.
their feet a lot. I think that's where we have a lot of issues. So, am I wrong, PSWs? If anyone's on this call, tell me. But I think that's something we've seen a lot as an association. Is the intentions are there, but there's simply not enough resources that are made available to accommodate this specific issue when it needs to be accommodated. So the question, I guess, is there a new type of PSW that we need to create that specifically deals with this kind of training? Is this type of specialty that's something that could be looked at, or something that people will be open to doing? I don't know.
Pauline, I see your hand is up.
Oh, yay, we have a guest. Go ahead.
Okay. Can you hear me?
Yep.
Okay, I'm coming at this from a slightly different angle. I wasn't sure what the content would be tonight. And I am in home care, not long-term care.
Mhm.
But I'm actually looking for guidance on the faith aspect of the faith and freedom. I
Yeah.
wasn't raised in any religion. And I really struggle with clients who show intolerance. I'd like some
Mm.
guidance on how to be respectful of their faith without rolling over and just accepting intolerance. You know what I mean?
Yeah. Yeah.
I find it's the faith part of it that I struggle with the most.
That's an excellent question. Pauline went right in.
Mhm.
So, Gabrielle, what are your thoughts?
Yeah, no, it's an incredible question, and it's always something I wish I had a one, single solution for that. Pauline, the work you do is immeasurably valuable, and it is tough. It is tough. I am queer and I'm also religious, and it's a tough spot to be in. And so, um, I what I would encourage you to do is just be firm in your boundaries. And that does, and your own beliefs. And Kayla, if you have any insight or suggestions on that, but it's a tough place to be in for sure. And I think that is also like a concern that you are not alone in experiencing. I think that's one of the reasons a lot of queer folks and members of the 2SLGBTQ community don't necessarily feel safe, and why they don't feel safe in coming out is because there are some very outspoken religious people who are very firm in their beliefs. And it can make places and people feel very unsafe. And yeah.
It's because if I'm understanding the question, Pauline, it seems to be a balance of rights issues. You have the right to freedom of faith, but you also have the right to communicate.
Yes.
So where do these balance out? And at the end of the day, the balance really comes into those individual interactions and how those interactions are navigated at those exact moments. There is no general balance because faith is impossible to measure as is. But it's such a good question. Oh my gosh.
Such a good question. Yeah. And it's something like you really just, it's situation to situation.
And I just want to add that for
Please.
myself personally, I'm fine. I worry about all my coworkers out there, you know, who are coming through. And this is a matter, you know, you do get a lot of different intolerances with your client base. I want to be able to set the tone. But because I don't have a religious background, I struggle with, I get nervous around faith because I don't want to disrespect my clients, but I also don't want to set up an environment for anybody who comes into those environments.
Yes.
That just shores up that intolerance.
Yeah, most definitely. I definitely want to respond to that, but my colleague Kayla has her hand up, so I'll hand the mic over to her.
Yeah, thanks so much for your question, Pauline. And I can imagine there's another layer of delicacy here, given that you're doing home care and you're entering someone's home, and the just added layer of, you know, trying to be extra respectful in that space. And it's really helpful to hear from you and through our other interviews of other PSWs who have their feet on the ground, like what are some of the challenges that you deal with in your day-to-day? Because part of this research is, of course, hearing from you and then helping to create recommendations on how to improve the experience for you and residents. So while we might not have, you know, the perfect answer for it today, it's something for us to kind of take back and workshop with our team who's at RFF, whose mission is to create more inclusive spaces that touch on that religious piece. So it's helpful for us to know and note down and kind of work through that, especially as some of the other challenges roll in. And I think Gabriel mentioned this in the beginning, but this entire project will result in like a written report with actionable recommendations for all the parties involved. So we'll definitely be sharing that back with you, Ian, and hopefully we can circulate that and get you some like really practical solutions.
Absolutely. That'd be great. It's because
Yeah.
it's
Thanks, Drew.
Yeah, sorry. Yeah, that's great. I think we have a bit of just a general provincial identity crisis and how we deal with how we deliver care and how we treat our residents. Because you're right earlier, a lot of these were founded, a lot of our healthcare delivery models actually come from the 19th century, and they were delivered by religious institutions. So that a lot of this culture still kind of exists there and exists. Continue on, please. I apologize.
Yeah, I wanted to thank my colleague Kayla because it's true, and it really circles back to why we're here today, which is to hopefully get some insight from you. So, Pauline, if you're okay with me asking you a question, I'm curious to know, like now hearing the barrier and challenge you faced, what would be helpful for you in providing more inclusive care or making you feel safer in those spaces? What are things you think maybe RFF could provide or Kayla and I could take away and noodle on with our team that would help you navigate that religious space? If you have any, if you don't, that's also okay. But I'm just curious to hear if there's anything that would maybe be helpful and in allowing you to provide this kind of care.
Hey, can I just ask a question as well, Pauline, if I can get on there, just so I could, is the concern about, because I'm someone who's more secular, right? I'm not a faith, I don't go to church or anything. So is it that you're having difficulty in how you interact with people that are strong in their specific faith?
I find it very hard to know how to deal with a situation where somebody expresses a faith-based belief that is homophobic. You know, I don't know how to respect their faith in that situation. And I know that that's an important thing to do. So I don't know. I mean, I do look for ways to educate myself on different faiths. I have considered wearing, again, it sounds kind of silly, but like a coded, rainbow button or something, so that those who know I'm friendly. But it seems like, why, it frustrates me to have to dance around it, but
It's a really touchy,
it's a different population. It's an older population. They don't have the same experiences we have. And again, the religion part really kind of, I never know what to do when I get against a religion as the rationale.
Because, well, at the end of the day, I think, and this is the direction I can give, PSW care and home care is generally a more clinical, secular model of delivery of care model. So we don't have a lot of tool when these situations come up. So I don't know. It's a real tough one. But please continue. I apologize, Gabriel. Thank you so much.
No, it is. We do have I do have home care, but some of my clients live in faith-based seniors,
right,
apartment complexes and that kind of thing.
No, I mean, as an association, we don't have a policy direction specifically on how to navigate these situations yet. It's one of those things that we're still at the embryonic stage of. So it's good we're having this discussion.
I do love that we're talking about inclusion from the sexuality, from the LGBTQ plus perspective. But for me, the really baffling part is the faith.
Yeah. And I think when there are seniors who are caught at that intersection of being a part of a faith-based community or being in a faith-based long-term care home or a senior's home or hospice, but also identifying as a part of the LGBTQ community, that's also something they struggle with too. So Pauline, you and your residents might have something in common. But if I can give a little piece of insight from previous research that Kayla and I have done, not on long-term care homes, but we've done a lot of other research just at the intersection of 2SLGBTQ identities and religion. Something that has been really powerful to our signs and symbols. So that thing you mentioned about wearing a pin is something we've written up about in previous reports on other studies about the power of signs and symbols, not necessarily to satiate or help mitigate homophobia and transphobia, but to make people in the 2S LGBTQ community feel safe. So I can't necessarily give you advice on navigating homophobic and transphobic religious folks, but I can tell you how to make your queer residents feel really safe and seen.
We'll take that. I think that's worth something very much.
That'd be great.
Absolutely.
Yeah. Okay. Does anyone else have anything they'd like to share with us about your experience, what it's been like working with queer and trans folks, and maybe any suggestions on what might be helpful for you in providing inclusive care? If not, I can move ahead.
I don't think anyone, I think we covered it pretty good. I think the big use that basic guidance. I think Pauline hit the nail on the head.
Yeah.
I really do. Thank you very much for that.
Thank you. Okay, so now I'm going to share a bit of a call to action about our survey and interview. So to stay involved, sorry, I'll just go back here. We're continuing this work. So we spoke to a few long-term care folks who work in long-term care, PSWs, so on and so forth. But ultimately, your voice matters, and it's so important. Your experience is invaluable. If you work in long-term care, hospice, or home care, we'd really love to hear from you in our short survey. And then at the end of that survey, you can indicate if you'd be open to having a one-on-one kind of informal discussion with us. So one is anonymous, the other may not be. But we can also blur your name and anonymize you if that's something you're interested in. Your experiences will help us advocate for stronger inclusion policies, better training, staff spaces for 2S LGBTQ plus residents, and safer spaces overall. So the link is on this next slide. I'm also going to be.
I just added it to the chat.
Thank you.
Kayla's ahead of you there. She got you. It's all good.
Awesome. It's great having someone else in the back. So to stay involved, please fill out the survey. It'll help us better understand your experience. We'll receive it in our back end. And so this one is a little bit more anonymous. It's more generalized. It's super quick. And we're also looking to hear from folks who work in these spaces, if you're willing to give us more than 5 minutes. They're one-on-one sessions. They're an hour long each. They're run by or facilitated by myself or Kayla, who's also on the call. And In those spaces, you can kind of just be a little bit more vulnerable and open, and we'll go a little bit more in depth. Otherwise, to stay involved and stay connected, you can visit our website, and that is where you can find all of the resources we have available and the reports I was referring to. They're all free of charge. They're just on the website. You can also subscribe to our newsletter or follow us on social media or all of the above. We share a lot of updates about this project and other coming other projects, as well as upcoming initiatives. So every share, conversation, and story helps expand this work. You are so valuable, and we're so grateful you came today to this session. Yeah, so thank you so much for your attention and your openness today. We'd love to hear your thoughts, questions, and reflections. So if anyone has any of those before we close, I'll just open up the floor one last time.
I think we have a shy group tonight.
No, that is a-okay.
But
I'm
so
great.
we will, of course, be circulating this survey amongst our membership for those who couldn't attend this evening. And we're back on Wednesday morning, right?
Yes, at 9 a.m. Yeah.
9 a.m. We're starting an early one, and we'll have it polished by then, more than this evening, but we did great. So this has been extremely informative. This is an area topic we don't talk a lot. We haven't actually been having a lot, but this is something that's going to be remedied. And I want to thank everyone for coming tonight, especially Kayla, Gabriel, much obliged. This has been excellent, and I do appreciate it. We're scheduled till 9 o'clock. I mean, I'm happy to continue talking for an hour, but I really don't think there's any even listening to me chatter on. No, if anyone doesn't have any questions, we can wrap it up. And I want to thank you. There's something in this sec. It was an important topic. Thank you. Okay, yes, I agree. Well, thank you again for everyone that coming, Gabriel and Kayla. I'll see you both Wednesday. If there's anything you need prior, don't hesitate to reach out. I will make sure this is available. And everyone appreciate it. Okay, again, likewise. Nice seeing you both, and we'll see each other Wednesday morning. For those on Wednesday morning, this is just another version of this session for another group. So feel free to jump in again if you want to participate again. So
Thank you, everyone.
Thank you, everyone. It means a lot. Thank you so much. Have a lovely evening. Bye now.
Bye. Thank you.
Bye.
good night.